Okay, so once again, good day everyone. Today we'll be starting the microbiology aspect. It's really a very long part of the step one discussion. We'll try to move fast as much as we can and focus on the important things. Okay, so the first is talking about basic bacteriology. So just talking about the basic composition of a bacterial cell. So what is it made up of? So the first are the appendages. So with respect to the appendages, we just need to know two things: the flagellum and the pilus or the fimbriae. The flagellum or the pilus or fimbriae. So the fimbriae is a little bit different from the pilus in the sense that the fimbriae is important in maintaining adherence of the bacterial to the cell surface. So if the bacteria wants to attach to the surface of a cell, they use the fimbriae. While the pilus is involved in what we call conjugation, which we are going to talk about shortly. So conjugation is a means by which the bacteria is able to transmit genetic components from one cell to another cell. So the fimbriae allows for attachment to a bacterial cell, while the pilus allows for transmission of genetic material through the process of conjugation. The flagellum, which you are very familiar with, is important in motility. So if they say that a cell is flagellated, so that means that it can move through whipping action of that flagellum. So what is common to all these three structures is that all of them, they have proteins. They are made up of proteins. So that means that all the structures are antigenic. They can provoke immune response. So that's that, and the fimbriae and the pilus, they have a carbohydrate moiety to the protein. So they are made up of glycoprotein, while the flagellum is strictly from proteins. So don't forget their functions, very, very important. Moving on to the specialized structure. So this is more like an accessory structure, and that is a spore. And before I move further, I must emphasize that the spore is only present in the gram-positive bacteria. Only the gram-positive bacteria have the spore. And what are the composition of the spore? We have the keratin-like coat, the dipicolinic acid, peptidoglycan, and the DNA. Now, I was trying to look for an image, but then I could not get an image that bacteria spore components. So there was no image that actually highlighted all the structures. So this was the image I got just to show us. So just like I said, the spore, please let us mute our mics. Let us mute our mics. Let's mute our mics, please. So this is a spore of a gram-positive bacteria. So there's a central DNA, and the DNA is surrounded by other structures. From the outermost part, we have the keratin coating. So this is a keratin coat. It has is more like a cell wall, which is this yellow part, which is made up of peptidoglycan. Of course, because it's gram-positive, they are made up of peptidoglycan. I'm going to explain that too shortly. So peptidoglycan cell wall and outer keratin coat, the innermost DNA that is protected by the peptidoglycan cell wall, the outer keratin coat, and in between them, you have another extra layer that is made up of the dipicolinic acid. So the innermost structure that is protected is a DNA. So that's a DNA of the gram-positive organism. The next is the cell wall, which is the peptidoglycan cell wall. Then we have the dipicolinic acid coat, then the outer keratin coat. So that is what is being listed here. Just know that we have the DNA protected by peptidoglycan cell wall, surrounded by dipicolinic acid and the keratin coat. Now, a gram-positive organism will assume the spore form when the environmental conditions are not favorable. Probably there's no water, there's no sunlight, there's no nutrients for it to grow. So it assumes a dormant form, which is a spore form. So in the spore form, metabolism is low. So they are doing that so that they can prevent themselves from getting dehydrated. They are doing that so that they can be resistant to heat damage and also damage from chemicals. So I want to mention that the dipicolinic coating is important to protect against desiccation from heat. So once you say dipicolinic, you know that that is heat protection. While the keratin protects against dehydration, heat, as well as the chemicals. So don't forget, it is only gram-positive that contains the spore. Only gram-positive, and they assume the spore form. All the component of the cell is being, converted to that spore. But once the environmental condition become favorable, they will now change from that spore into the normal bacteria. So that's why you see that all these things that makes up the spore also makes up the bacteria. All bacteria will have DNA. All of them will have peptidoglycan cell wall. So that's the way it works. Then moving down to the cell envelope. Now, before I start, I must first emphasize that there is a part of the cell envelope that is a capsule. And you cannot go for your exam and you want to blast microbiology aspect and you don't know anything about capsule because you are going to see capsule in so many places. I can assure you. The first thing to hold on to with respect to the capsule is that most of them, they are made up of polysaccharide. It is rarely derived from proteins. Most of the time, it is polysaccharide. So this is not the flagellum, this is not the fimbriae, this is not the pilus that's made up of protein, but the capsule is polysaccharide. That's why you see them mentioning polysaccharide capsule covering. So the capsule is derived from polysaccharide and they are protecting against phagocytosis. If that is the only thing we'll pick from this basic bacteriology today, with respect to the bacterial structure, please, I'm happy. Capsule protects against phagocytosis. You'll be asked. You will be asked, what is the function of the capsule? It protects against phagocytosis. So moving on to the slime layer. The slime layer is also made up of the polysaccharide, just like the capsule. But the function of the slime layer is to allow the bacteria to form what we call the biofilms. So you notice that there are some organisms that they like attaching to cell surfaces. Not bacterial cell now, but object surfaces. For example, prosthetic device. For example, catheters, IV lines. All those uh, attachment is mediated by the slime layer. So if a bacteria has a slime layer, it will be able to form a biofilm, more like a colony of bacteria surrounding an object. Maybe the catheter, it could be the prosthetic, it could be prosthetic heart valve, prosthetic joints, any foreign body, slime layer, biofilm, slime layer, biofilm, slime layer. Now we move to the outer membrane. Now, for the outer membrane, it is only the gram-negative that contains the outer membrane. And this is what the outer membrane is made up of. So, if you look at this image here, this particular part, this is the outer membrane. You cannot go for the exam and you don't understand the basic composition of the outer membrane. The outer membrane is only native to the gram-negatives, and it's divided into the outer leaflet, the embedded protein, and the inner leaflet. But you don't need to know that three. For the sake of exam, don't waste your time. The most important part of the outer membrane is actually the component of the outer leaflet. What is in this outermost part is what is important to you. What is here is what is important to us. So this is the outermost leaflet. You have the outer membrane protein submerged in between them. For example, the porine here, and you have the inner leaflet. But you don't need to worry yourself about all those extra two. It is the outer component that we need. And what is contained in the outer leaflet of the outer membrane, that is the endotoxin. Very, very important stuff. The endotoxin. The endotoxin. And what is this endotoxin made up of? The lipopolysaccharide or the lipo-oligosaccharide. The lipopolysaccharide or the lipo-oligosaccharide constitutes the endotoxin of the outer leaflet. Now, the difference between them is that majority of the gram negatives have LPS. It is only Neisseria that has LOS. So if they ask in your exam, what is the uh, endotoxin or the outer leaflet part of the uh, outer membrane of Neisseria composed of? Don't pick LPS. It is going to be LOS. Why for the other organism, it is LPS. But what is common to all these LPS, LOS? Lipid, because the word is lipopolysaccharide or lipo-oligosaccharide. Lipopolysaccharide because you are coupling lipid to a polysaccharide. Lipo-oligosaccharide because you are coupling lipid to an oligosaccharide. But the lipid is constant to two of them. And that is lipid. That lipid is actually what you are even now further interested in. What is that particular lipid? Lipid A. You forget this at your own risk. Lipid A. Lipid A is very, very important because lipid A is the reason why gram-negative organisms can cause septic shock. That is the reason they can cause septic shock or endotoxic shock. How? Whenever they are broken down, they are going to induce the cells they are affecting or the human being or everything they are infecting to release, TNF factor as well as interleukin 1. So interleukin 1 and TNF cytokines are going to be released, and this will perpetuate the inflammatory cascade leading to sepsis. So you must know the function of lipid A. It is part of the endotoxin, and it will induce release of TNF and interleukin 1, causing septic shock. We are going to talk about it. Now, moving on to the periplasm. The periplasm is a space between the outer membrane and the cytosolic membrane or the cytoplasmic membrane. So, this is the outer membrane here. This part I have circled. The next part, which is this part, is the cell membrane. The space in between them here is the periplasmic space. And what does it contain? Hydrolytic enzyme. That is where they keep their enzymes, particularly the hydrolytic enzyme. And which hydrolytic enzyme are we talking about? Beta-lactamase. We're going to talk about this later. Just hold on to it like that. Beta-lactamase. The beta-lactamase are hidden within the periplasmic space. So, you typically find the space between the outer membrane and the cytoplasmic membrane. The next is the cell wall. The cell wall is made up of peptidoglycan. So this is the cell wall. We can see that the cell wall of the gram-positive is well developed. It's like 3. While the cell wall of the gram-negative is not well developed, it's not strong. It is only one layer. And we can see that the outer membrane is not present within the gram-positive, just like I've said. It only has a thick peptidoglycan cell wall. So peptidoglycan is the sugar backbone that makes up the cell wall of the gram-positive, and it confers some added advantage to them. How do we form this peptidoglycan cell wall? We need to couple peptide, which is a peptidyl component, to the glycan, to the carbohydrates. But these peptides are like emerging as branches. So the way it is that if you have carbohydrates like this, carbohydrate like this, carbohydrate like this, the proteins are usually like side chains coming out, coming out, coming out. So they need to be cross-linked together. So that is where the enzyme transpeptidase comes in. So the transpeptidase helps in cross-linking of the peptide side chain of the peptidoglycan wall. You cannot forget what I've said. And what are the proteins that have this transpeptidase activity? We call them the penicillin binding protein. So there's somewhere this penicillin binding protein are hiding in the cell, which I'm going to show us. And they have this transpeptidase activity such that if the cell wants to synthesize a new cell wall, it is going to activate this penicillin binding protein. And because they have transpeptidase activity, they will start cross-linking the peptide side chain to form the complete peptidoglycan cell wall. And what is the function of the cell wall? It is there to provide rigid support for the cell so that it doesn't die easily, it doesn't break, and also to offer resistance against osmotic pressure. Because just imagine that a cell gets filled with too much water, it will start ballooning, But because of the peptidoglycan cell wall, it will not burst. It offers resistance against osmotic damage. So the cell wall is to offer rigidity and protect against osmotic injury. Then finally,
can you say? I'm sorry if you haven't finished that one. Before you get to another one, can you repeat what you said about the transpeptidase again? How it is across?
Transpeptidase enzyme is an enzyme that cross-link protein. I said that the peptidoglycan wall is made up of glycan, which is carbohydrate. These ones that I've drawn, these are the carbohydrates here. These are the carbohydrates. You have the peptide side chain projecting from the carbohydrates, but you need to cross-link them to make them peptidoglycan to be strong, and that is where transpeptidase comes in. But what is this protein that has transpeptidase activity? Penicillin binding what? Protein. So penicillin binding proteins have transpeptidase activity that can help to cross-link the peptide side chain. The last component is the cytoplasmic membrane, which is the one that is beneath. It is common to both of them. Both of them have cytoplasmic membrane, right? And this is where we have the penicillin binding protein that I'm talking about. This is where they are. So, and this cytoplasmic membrane also contains some oxidative and transport enzyme. Yeah, just like we have the hydrolytic enzyme in the periplasmic space, we have the oxidative and some transport enzyme within the cell membrane or the cytoplasmic membrane. And the way I remember that is that the cell membrane is just the next barrier to the cell properly, to the cytosol, because once you breach this cytoplasmic membrane, the next thing is you are entering the cell, because this is going to be the cytoplasm. This area that I'm showing, this is cytoplasm. You see, all this other area, they are the outermost part. Please, do you understand what I'm trying to represent here? Do we get what I'm saying? Like this, just imagine that this thickness that we are seeing here is represented by all these things, like all these things. Is just the magnified form of this thickness. Do you understand what I'm saying?
Yes.
So once you breach this thickness and you come in, you enter the cytosol of the cell. So that means that the closest portion to the cytosol is what? The cytoplasmic membrane. So that means that what should be there should be like, transport enzyme that can easily transport something from the outer environment into the cell immediately. So that's why we have the oxidative and the transport enzyme in the cytoplasmic membrane. The penicillin binding protein 2 is there so that it can just help to synthesize the cell wall that is just superior to it directly, because it contains what? The penicillin binding protein. And we said the penicillin binding protein has what activity? They have transpeptidase activity. Now, who remembers the component of the cell envelope that contains lipopolysaccharide or endotoxin? Anybody remembers from what we have discussed?
The outer membrane.
The outer membrane.
The outer membrane. Good job. Now, that is for gram negative, because it is only gram negative that have outer membrane that contains endotoxin. And what is this endotoxin? Lipopolysaccharide or lipo-oligosaccharide. Now, does it now mean that gram-positive organisms cannot cause septic shock? They can cause septic shock, but they are not going to be using lipopolysaccharide or lipo-oligosaccharide, which are like endotoxin. No, they will use lipotecoic acid, lipotecoic acid, lipotecoic acid. This lipotecoic acid is still going to release what? Interleukin 1 and what? TNF alpha. just like the lipid A of our lipopolysaccharide or lipooligosaccharide. But we don't find the lipoteichoic acid in the outer membrane because gram-positive don't even have any outer membrane. So where do we have the lipoteichoic acid hiding? The cytoplasmic membrane. So you just see the lipoteichoic acid projecting here. This is it here. This part projecting like this from the cytoplasmic membrane. So just a quick cap. The capsule, contains polysaccharide for what? For phagocytosis. The slime layer contains polysaccharide too for biofilm formation so that they can adhere to objects. The outer membrane is the one that contains the endotoxin, which is lipopolysaccharide or lipooligosaccharide, depending on the organism. And that release TNF and interleukin-1 for sepsis. The next is the periplasmic space between the outer membrane and the cytoplasmic membrane that they hide their hydrolytic enzyme like beta-lactamase. The next is the cell wall, which is well developed in the gram-positive, and it helps to offer rigidity and osmotic support, and it is formed by joining the glycan to the peptide. But you need to cross-link the peptide, and you need transpeptidase to do the cross-linking. And the protein that has a transpeptidase activity is penicillin binding protein. Where do you find the penicillin binding protein? In the cytoplasmic membrane. Which other protein do you find in this cytoplasmic membrane that can allow food to enter into the cell? The transport protein, the transport enzyme, and the oxidative enzyme. What other thing do we have in this cytoplasmic membrane? Lipoteichoic acid, which is more like the equivalent of LPS and LOS in the gram-negative, that helps gram-positive induce sepsis. This is well explained here. We should take note of all those things. The next are the stain. How do we identify all these organisms? We need to stain it. We need to stain it. So what do? We get a slide. We add the drop of the organism. Then the first thing we are going to add is crystal violet. Crystal violet. Crystal violet, which is purple in color or violet in color. Then the next thing is to add like a mordant to fix it to this slide, which is what? Iodine. Then the next thing is to add more like a decolorizer, something that would wash all those things away. And that is when we use alcohol. Sometimes we can use acetone, but most of the time, alcohol, it is what it's used by these people. I find it very difficult to write with this thing. So, alcohol or acetone can be the decolorizing agent. Then after you have decolorized, you can now apply a counter stain, which is what? Safranin. Safranin is red in color or pink. Red or pink safranin. The premise stain is crystal violet. So you add your crystal violet, you add a mordant to fix it, which is iodine. You decolorize with alcohol or acetone. Then you counter stain with safranin. Now, this is now the basis for the gram staining classification. The gram-positive, we said they have a well-developed cell wall. So that means that the cell wall is big enough to take up the crystal violet primary stain. So at the end of the day, if you try to decolorize with alcohol, if you try to counter stain, it is not going to take all those things because it has already taken the crystal violet dye. And what did we say is the color of the crystal violet dye? It is what? It is purple in color. So that is why gram-positive organisms will appear purple, because they would retain their primary stain, which is the crystal violet. For gram-negative, they don't have any peptidoglycan cell wall. It is weakly formed. So that means that if we apply the crystal violet, it is only little that will be taken. By the time we apply alcohol to wash it out, all the crystal violet will be washed. So after we have washed out the crystal violet, if we now apply the counter stain, which is safranin will be retained. So that is why they would appear red or pink, which is the color of safranin. So let me just show us a picture and we can identify, gram stain slide. And let's see, what we have. So, this area that my cursor is on, anybody wants to, what this gram stain organism likely to be? Anybody? This one I'm circling from our
Gram
study.
Gram
positive.
positive.
So this is the gram positive part. Why these ones are going to be the what? The gram
Gram
negative.
And don't forget the basis for the difference is due to what? The peptidoglycan cell wall that is well developed in the gram positive. You can't forget that. It's as simple as that. Now, there are some particular organisms that you cannot see by gram staining. What are these organisms? And why can't we do gram staining to see them? So the first two is Treponema pallidum, which is syphilis, and the Leptospira organisms. So these guys are spirochetes. Under the spirochetes, more like snake-like organism, we have three: Treponema, Leptospira, and Borrelia. So Treponema and Leptospira and Borrelia, they are too thin to be visualized. You cannot see them because they are too small. So that's why we cannot gram stain them. So we have to be doing maybe we are doing dark field microscopy, or we are using fluorescent antibody stain to look at them. So we can't use gram stain with normal light microscopy to be seeing Treponema and Leptospira because they are small, tiny worms that we cannot see. Spirochetes, we cannot see them. Too thin. The next is Mycobacterium. Why can't we see Mycobacterium? It is not because Mycobacterium is too thin. No, Mycobacterium is not too thin. But the reason is that the cell wall of Mycobacterium has a component that we call mycolic acid. So the mycolic acid component of TB, of the mycobacteria. So sorry, don't quote me. I said TB. No, I should be saying mycobacteria because there are so many things that could fall under mycobacteria. Mycobacteria leprae, which is leprosy, Mycobacterium avium. So the mycobacteria, all of them, they have a very high lipid content, mycolic acid, that does not allow them to pick any stain. So they don't pick safranin, they don't pick crystal violet, they don't pick anything except some specialized stains. So that is why they cannot be seen on gram staining. Then, mycoplasma and ureplasma, they have no cell wall. Mycoplasma and ureplasma don't have any cell wall. Mycoplasma and ureplasma are cell wall-less. So that is what, and we know that what is picking the stain is the peptidoglycan stuff. So if there's no cell wall, nothing to pick stain. So they cannot be seen, unfortunately. Then the last category is what I call clear of stains. So these guys are clear of staining because they are primarily intracellular. So just imagine that a particular organism is within a cell, is within maybe epithelial cell, maybe macrophage, for example. Macrophage is a very good example. They are within the macrophage, right? Our gram stain will not be able to penetrate into the macrophage. So because they are primarily intracellular, we cannot gram stain them. And that falls under this clear of staining stuff. So what is C? Chlamydia. L for Legionella. E for Escherichia. A for Anaplasma. R for Rickettsia. So as we move, we are going to be talking about anaplasmosis, ehrlichiosis, and all those guys. We have to know them. So clear of stain is because they are primarily intracellular. There's another thing with respect to chlamydia. Chlamydia peptidoglycan cell wall is not there, just like that of mycoplasma and ureplasma, because the level of the muramic acid, the N-acetylmuramic acid component of the peptidoglycan cell wall of chlamydia is reduced. So that is why the peptidoglycan cell wall of chlamydia is not well developed. So in addition to the fact that it is intracellular, the cell wall also lacks muramic acid. So please don't forget that stuff. Don't forget it. Muramic acid. So because of the reduced muramic acid component of chlamydia, it does not pick the stain. What about Giemsa stain? So for the sake of our exam, I just want us to have one thing at the back of our mind. We said it here that we cannot see Treponema, Leptospira, and Borrelia. So you can actually use Giemsa stain to see Borrelia. So that's the stain of choice. And when they measure Giemsa stain, one thing that should always come to our mind is that, are they using it for any protozoa? The flagellated protozoa, particularly trypanosomes and Plasmodium. Plasmodium for malaria, trypanosome for trypanosomiasis and the likes. They are both protozoa, and they are seen with Giemsa stain. Then, this chlamydia too that we cannot stain, we use Giemsa stain for it. And I want to mention that chlamydia and rickettsia go together. Most of the time, you can pick them together. They go together. If chlamydia cannot do something, rickettsia too will not be able to do it. They are twin brothers. So Giemsa stain works for chlamydia, for its twin brother, which is rickettsia, and for the flagellated anaerobes, flagellated protozoa rather, which is trypanosomes and the Plasmodium. You don't need to know everything. Just know a few common ones and you are okay. The next is a periodic acid Schneiff stain. We have talked about this maybe in GI or so. And this PAS stain typically stains for glycogen as well as polysaccharides. So any infection, any organism that have a lot of this accumulating within it, so they can easily pick up this and they can recognize our organism. So this Treponema whippae infection causing this Whipple's disease, there's a lot of glycogen, mucopolysaccharide being released. So that's why we can easily see this Treponema whippae with this periodic acid, because it's going to provoke some inflammatory process in which there will be recruitment of macrophages. And the macrophages will have a lot of glycogen and mucopolysaccharides in them that can be easily stained with the PAS, leading to recognition of these organisms. So this is what it looks like, the periodic acid Schneiff stain. This flagellated one is like trypanosome. This is the way they look like. They look flagellated like this. You can see the blood. So this is, what stain is this going to be? Anybody?
Giemsa stain.
Giemsa stain. Good. Giemsa stain. So moving on to Zinn-Nelson stain. So Zinn-Nelson stain is another type of stain, and the primary stain in Zinn-Nelson stain is carbofuchsin. Don't forget that. The primary stain in Zinn-Nelson stain is carbofuchsin, and we use it for acid-fast organisms like the Mycobacterium. So Mycobacterium that we cannot see because of thick mycolic acid. What we are going to use is the Zinn-Nelson stain. So it can penetrate into that cell wall. And another organism that can be seen with the acid-fast stain is Nocardia. Nocardia is weakly acid-fast. So it can also be seen with this Zinn-Nelson stain, as well as the Cryptosporidium. So 3 organisms to be familiar with: Mycobacterial organism, Nocardia, Cryptosporidium. They can be seen with the Zinn-Nelson stain. And there's also an important point here, which is the Oramine rhodamine stain. Oramine rhodamine stain. Oramine rhodamine stain is another stain. Please, let's mute our mics. It's another stain that can be used to screen for Mycobacterium infection because it's very, very fast. It's inexpensive and more sensitive than acid fast. So it's very inexpensive and more sensitive. So that's why we use it for screening. So if they ask us, what stain are you going to use to screen for Mycobacterium? We are going to pick Oramine rhodamine, not Zinn-Nelson stain. Important stuff. So this is the Zinn-Nelson stain. So you are going to see the primary stain is going to appear like purplish like this, and you are going to see a blue background. Anybody have an idea of the commonest background you are going to see if it's a gram stain? Anybody have any idea of what the background would be? So most of the time it's going to be like maybe red, because the background might take the color of the counter stain. which is one we're applying last. So, but once you see a purple organism like this with a blue background, that is senescent stain, because the counter stain that is used here is what is methylene blue. So it's going to impact that blue background, and the carbofuchsin is the purple one that we are seeing like this. So this is what's it called? The senescent stain for acid-fast organisms. So that means that you cannot bleach them with acid or alcohol. That's why we call them acid-fast. They cannot be bleached with acid or alcohol. Indian ink. The only organism that uses Indian ink is Cryptococcus neoformans. We are going to come across this guy a lot of times, so we have to be familiar with it. Cryptococcus neoformans. It is a fungal infection. Fungal infection, Cryptococcus neoformans. And the stain we will use is Indian ink stain. And this is the Indian ink. You just see like a chocolate background with some white colonies. So once you see this white colonies with chocolate background, this is Cryptococcus neoform. And all this white stuff that we are seeing, that's the capsule of the Cryptococcus. That is the capsule of the Cryptococcus. That is the capsule of the Cryptococcus that is being outlined. We can also use a stain that we call the mucicamine stain. So that one also helps to stain the thick capsule of the organism. I think I have a picture here, for probably I have to search it again. Mucicamine stain for Cryptococcus. So it looks reddish. So we have it here. Excuse me, just 1 minute. So sorry about that. So I think I'm trying to show the picture of the mucicamine. So sorry. So this is what it looks like. So this is what it looks like. See this reddish round colonies like that. That is the capsule of the fungal infection being outlined. So most of the time they would actually show us the Indian ink because it's much more commonly used than the mucicamine. But just for our information, we need to know it too, that you can use the mucicamine for Cryptococcus. Then the next is the silver stain. Silver stain is used for fungal. Once you see the word silver, the next thing you are checking for in the question, is there any fungal infection that is there? And most of the time, the background for silver stain is usually green. It looks greenish. So this is silver stain, green. And most of the time, they use it for fungal infections such as pneumocystic jirovecii, Aspergillus fumigatus. You can use fungal stain. You can use the silver stain to look at them. And also commonly, Legionella. So those two organisms is important with respect to silver stain. Legionella and the fungal. So if you want to remember everything, you can memorize this code, but it's not actually very important. Once you know Legionella and the fungi, you are okay. So the code is the silver fungi loves black helicopter. So the silver stain for the fungi, loves for the Legionella, the B for the Bartonella, and the H for the Helicobacter pylori. So the next are the fluorescent antibody stain. So we use this one for a lot of organisms, but commonly we use it for syphilis, the fluorescent antibody stain for syphilis. So moving on to the culture requirements, you need to culture some of those bacteria because to grow them, you need to, put them in the culture so you can visualize whatever organism, you are dealing with. So the first one is Haemophilus influenzae. And what culture is typically being used? The chocolate agar. So this is a selective agar that allows Haemophilus influenzae to grow. And what is the composition? So you need to know this. It contains factor 5 and factor X. So factor V and factor X. And factor V stands for NAD+. And factor X stands for hematine. Hematine and factor V stands for NAD+. NAD+ and factor and hematine. Very, very important stuff we should not forget. NAD plus and MRT, factor 5 and factor X. Selective medium, because we are selectively putting some things that can only allow Haemophilus influenza to grow. Now, so we have some modified medium too, like thiamartin agar. So this is more like a modified, selective medium now, because you are adding something else that's going to inhibit the growth of other organisms. So the thiamartin agar is necessarily, it's only used for the growth of Neisseria gonorrhoeae and Neisseria meningitis. Thiamartin agar, Neisseria, that's what you culture in the thiamartin. What does it contain? It contains some components that only allow for Neisseria to grow, and this component kills off other organisms. For example, it contains vancomycin that is going to kill any gram-negative organisms. It contains trimethoprim and colistin. Trimethoprim and colistin that is going to kill off gram-negative organisms. And it contains nystatin that's going to eradicate the fungi. So it's only Neisseria that can grow. All the gram-negative will be killed by vancomycin. All the gram-positive will be killed by vancomycin. All the gram-negative will be killed by trimethoprim and colistin, and all the fungi will be killed by nystatin. Then we have the Bordetella pertussis. How do you grow this? So you use the Bordetella Gengu, agar, or the Regan lower medium. We don't actually need to memorize all these things because there's a very low chance that will be asked. Very low chance that will be asked. The Bordetella Gengu is made up of potato extracts, Bordetella pertussis. So BP, Bordetella pertussis. So the B for the Bordetella Gengu agar, and the P for the potato. Then the Regan lower medium contains ABC, which is antibiotics, blood, and charcoal. The Corynebacterium diphtheriae too can be grown in two medium, which we are going to talk about later again. That is the tellurite agar and the Loeffler medium. The Loeffler medium and the tellurite agar. By the time we read all these things, we become familiar with them. So we might not even need to cram it. So once it's mentioned, it will readily ring a bell. So by the time we look at them, from time to time, we become used to it. So the Loeffler medium and the tellurite agar is used to culture Corynebacterium diphtheriae. So Mycobacterium tuberculosis, we can use the Lowenstein-Jensen medium. I know most of us are familiar with this. Lowenstein-Jensen medium from medical school. We talk about this a lot. Lowenstein-Jensen medium for tuberculosis, and also we can use the Middlebrook medium for tuberculosis. Mycobacterium pneumoniae, Mycoplasma pneumoniae. What is peculiar to Mycoplasma and Ureaplasma?
No cell wall.
They have no cell wall. They have no cell wall. So if they want to grow, that means you have to give them something to help them form, like maybe cell membrane, at least to offer some support, which is cholesterol. Unless they'll be eaten up, So we culture them using the eating agar. So eating agar for Mycoplasma pneumoniae, and it requires cholesterol. So we are going to talk about Mycoplasma pneumoniae a lot. It's a very important organism. You can't go for exam, you don't know Mycoplasma pneumoniae. The lactose fermenting enterics, about 4 or 5 of them, E. coli, Kleb, Citrobacter, Enterobacter. We culture them using the McConkey agar. The McConkey agar is for the lactose fermenting, and they give this pink appearance because they produce acid, which is a product of fermentation of lactose. So if you ferment lactose, you generate acid, CO2, and it imparts a pinkish coloration to the colonies. E. coli is a lactose fermenting enterics, but if you want to specifically know that, okay, this organism that I'm culturing, I know it's a lactose fermenting, but is it E. coli? So that's where you now further isolate your culture, using your eosin methylene blue agar. So if it shows a green metallic sheen color, that is, it shows like a green metallic fluorescence, you can confidently say that that organism is E. coli. So E. coli shows green metallic sheen using your eosin methylene blue agar, but it also impacts a pinkish coloration when you grow it in the McConkey agar. Is that clear to us?
Yes.
Okay. Then we have the Ellas, the Brucella, the Francisella, the Legionella, the Pastorella. So this one is not really important for us to cram it, but just to know it, we can grow them in the CIC, which is a charcoal yeast iron cysteine extract. So the charcoal yeast buffered with iron and cysteine. You can use it to culture your Ellas. CIC, charcoal yeast with iron and cysteine. Ellas. Then the fungal can be stained with which stain? Which stain for
Silver
fungi?
stain. Silver stain.
Silver stain. Silver
Silver.
stain. But if you want to culture them, you use Sabaroid agar. Sabaroid agar. Sabaroid agar is for fungi. I know we remember that too from med school. Sabaroid for fungi. Sabaroid for fungi. Okay. Now, moving on to anaerobes. So what is peculiar to anaerobes? Anaerobes can be remembered with this acronym ABCDF. A for Actinomyces estrelli. Actinomyces estrelli. B for bacillus and bacteroids. The bacteroides. B. The C for Clostridium. Clostridium tetani, for example. It is an anaerobe. The D is nothing. I just put it there to make sense. Then the F is the Fusobacterium. So if they tell us to mention some anaerobes, you can quickly rush through the acronym ABCF. A for Actinomyces, B for the Bacteroides, C for the Clostridium, F for the Fusobacterium. This guy likes the catalase and the superoxide dismutase. So that means that they cannot protect themselves from oxidative damage, right? Anybody remembers what we use to protect ourselves from oxidative damage? Anybody knows?
Antioxidant.
Antioxidant, like what? What vitamins?
Vitamin C and vitamin E.
Vitamin A,
E for
C,
echo.
Exactly.
Yeah.
Vitamin A, C, E. What else again? What else again can be done to protect oxidative damage by the cell? What else again is done naturally?
Glutathione.
Yes. Somebody mentioned glutathione peroxidase. Very correct. Yes. What else again? We talked about
scavengers.
Scavengers. Yes.
Oxidative burst, respiratory burst.
Yeah. So
System.
oxidative burst is the one generating the oxidative damage. So we are trying to take care of the oxidative damage now. So they can either undergo spontaneous decay, all the free radicals that cause oxidative damage. They can undergo spontaneous decay. You can release vitamin A, B, C, ACE, take care of them. You can use these enzymes, catalase, superoxide dismutase, working together with glutathione peroxidase. They can mop up all those things. And lastly, we talked about the metals that helps to transfer them. So we have ceruloplasmin to transport copper, and we have which one for iron? Hello? Which one for iron? Transferrin for iron. All those things mop up the free radicals and they will not be available. So, but unfortunately, anaerobes, they don't have catalyst, they don't have superoxide dismutase. So that means that they have a lot of hydrogen peroxide playing around, superoxide playing around, causing oxidative injury to them. Now, they are naturally foul smelling. So if you have a foul smelling infection, you have a high index of suspicion that that is likely to be an anaerobic infection. Why? Because the product of metabolism of anaerobes, they generate short-chain fatty acids that include propionic acid, acetic acid, which impact that smell. So that's when we start talking about necrotizing fasciitis, and we say that it's foul smelling. It's due to the fact that it can be caused by anaerobe that generates short-chain fatty acid component that gives it that foul smell. They are very difficult to culture because the typical culture medium will require oxygen, so making them difficult to culture. And their product of metabolism includes gas, CO2, and hydrogen. Same thing in necrotizing fasciitis caused by anaerobes. They have what? Crepitors, just like we explained in dermatology. And the crepitors is because they produce gas, which tracks within the tissue plate. So all this knowledge, you don't compartmentalize them. You link it together. That's the basis. So because they can generate gas, which tracks within the tissue plane, causing that crepitors. They are foul-smelling because you generate short-chain fatty acid, which gives them that negative smell. So anaerobes are normal organisms in GIT, but if it's aspirated from the GIT into the lungs, it can lead to aspiration pneumonia, and from there they can develop a lung abscess. Which antibiotics can't we use against the anaerobes? We can't use aminoglycosides. Why? Because for aminoglycoside to get entry into the bacterial cell, it needs oxygen to power the transporter. So the anaerobes themselves, they don't have oxygen. So that means that there's no way aminoglycoside can gain entry into the anaerobes to kill them. So aminoglycoside do not work against the anaerobes. What are the facultative anaerobes? So the summary here is that we have some organisms that they can use anaerobic pathways like glycolysis to survive, while we have the ones that can use both the oxidative phosphorylation and anaerobic to survive. So if there's oxygen, they would undergo oxidative phosphorylation and they will generate their ATP. But if there's no oxygen, they will just undergo glycolysis fermentation and they will generate their ATP. So organisms that can combine both of them, we call them the facultative anaerobes. And that includes Streptococcus, Staphylococcus, and some gram-negative enteric organisms. So moving on to to intracellular bacteria. So intracellular bacteria meaning bacteria that hide within the macrophages, the neutrophils, that's where they stay. So we have some of them that they are obligate intracellular. They are completely inside all those cells, those macrophages. They don't come out. In fact, they eat from the ATP produced by those cells. They cannot self-produce ATP. So that is your RCC, renal cell carcinoma, Ketia, chlamydia, and what? Candida. Don't forget, I've said it. The twin brother of chlamydia is what? Rickettsia. They go together. So both of them, they are part of the clear stains, the organisms that are intracellular that they cannot be stained, right? So both of them too, they can be used to, they can both be visualized using the GIMSA stain. They share so many things in common. They are obligate intracellular organisms. Once you take them out of the host, they are dead. And we have the facultative intracellular. So just like I was explaining under facultative anaerobes, facultative intracellular means that they can produce the ATP by themselves. And if you put them inside the cell, they will use the ATP produced by the cell to survive. So any which way, they will still live. How do you remember this? NBME SLI. NBME SLI. So N for Neisseria, the B for what? Brucella, the M for Mycobacterium, the E for nothing. So you replace the E with F, which is Francisella, right? Then we have the S for Salmonella, the L for Listeria, and the Y for Yersinia. So NBME SLI. It should be NBMF SLI, but it might not make sense. So that's why I say NBME SLI. So these are the facultative intracellular organisms. Then moving on to the encapsulated bacteria. So what is the basic composition of capsule of a bacteria? Anybody remembers?
Polysaccharides.
Polysaccharides.
And what does the capsule protect against?
Phagocytosis.
Phagocytosis. Very good. So now, microbiology, you must be familiar with this acronym, SHIN. We are going to talk about SHIN like 1 million times before we finish this microbiology. There's so many things you'll be using SHIN code to remember. One of them is the encapsulated organisms. So the S is standing for your Streptococcus pneumoniae. The H for Haemophilus influenza. Haemophilus influenza. Then the N for the Neisseria. So SHIN with the specs. The specs. So the S here is not strep pneumo again, but now it's going to be group B strep and Salmonella. So Salmonella is encapsulated. Group B strep 2 is encapsulated. Then P for Pseudomonas. The E for E. coli. The C for, I don't think C code for anything. I just put it there to make sense. Then the K for Klebsiella. The K for Klebsiella. The K for Klebsiella. So the S for another Salmonella, Group B strep, strep pneumo. So Shin and the specs for the encapsulated organism. So once you see encapsulated, you have to remember Shin first. Constant K. In fact, you can't forget Shin for encapsulated. They are the major ones. So the capsule is an antiphagotic factor. I've talked about that. And sometimes we can obtain the capsular polysaccharide to produce vaccine. For example, the PPSV23 vaccine. The PPSV23 vaccine for pneumococcus, for strep pneumo, is a capsular polysaccharide. But if you want to generate a PCV vaccine, please, have you heard of PPSV23 before? Anybody?
Yes.
Yes, very good. So the PCV vaccine for pneumonia is a conjugated vaccine. PCV, pneumococcal conjugated vaccine. The PPSV is a polysaccharide vaccine. So it means that they just take the capsule and they use that to make vaccine. That's it. That's the PPSV 23. But once they conjugate something to that capsule, it's changed to a conjugated vaccine. So PCV 15, PCV 20, PCV 21 now that we have now, all of them, they are a conjugated vaccine. And what you are conjugating to the polysaccharide is what? Protein. And why are you adding the protein? That is to provoke what? To provoke the T cell.
T cell immunity.
Yes, I know we have done it in immunology. You want to activate your T cell response because your capsular polysaccharide alone will never activate T cell response. This is for people that wants to get 250 plus. Those are the stuff you have to pay attention to. Your protein that is conjugated with your polysaccharide will further activate T cell response. And when you have a T cell response, you are going to have memory cells. That is it. So your conjugated vaccine is far more preferred. So if a bacteria is having capsule and it's a virulent factor that makes it cause infection, doesn't mean that the body is going to suffer. No, God also have a plan for us to take care of them, and that is where our spleen comes in. So we have our spleen to release some opsonin, which is what? IgM and IgG. So IgM and IgG are released from the spleen, and they have a way of opsonizing those encapsulated organisms and eliminating them. So it means that anybody that is asplenic, either from trauma or from sickle cell disease, and they can no longer, achieve that splenic function, that means they are at high risk of getting infected with what? Encapsulated bacteria. It's as simple as that. So you need to give them vaccine against the most important one, which is what? The Shin. We can't give them vaccine against everything, but at least give them vaccine against the Shin, which is what? Strep pneumo, Neisseria meningitis, and the H. influenza. Moving on to the urease positive organisms. The urease positive organisms are organisms that have ability to produce urease. And what is the function of this urease? From the word, it has the ability to split urea into ammonia and CO2. But you don't need to panic. CO2 is an acid. Ammonia is a base. How do we know which is going to change the pH? The only thing you need to consider in your mind is that which of the following is more volatile that can diffuse. Okay, CO2 will be passed out through the respiratory tract to the external environment, but ammonia will stay. So that is why, at the end of the day, if an organism has urease activity, there's going to be elevated pH because there will be alkalinity. There's a very common organism that we test by doing like urease analysis. Anybody remember that organism? Urease test, urease breath test.
Oh, Helicobacter
Helicobacter
pylori.
pylori. This is Helicobacter pylori standing here. So the way we can remember urease positive organism is to what? To remember P chunks, P chunks, P chunks, P chunks. The P for the most important urease organism, which is what? Proteus. Cannot forget Proteus. P for Proteus. The C for Cryptococcus. So what's the stain for Cryptococcus? Anybody remembers?
Indian ink stain.
Indian
Indian
ink,
ink stain.
Indian ink,
Indian.
or the Musicamine stain.
Musicamine stain.
Then the H is for H. pylori. The U is for ureaplasma. What is peculiar to ureaplasma?
The last
Last
one.
cell
It
wall.
lacks cell wall. The N for nocardia. What is peculiar to nocardia?
Is weakly acid.
Weak acid.
Fantastic one. Weakly acidic, acid fast rather. K for Klebsiella. The S for staph epidermidis, and the other S for staph saprophyticus. Now, pay attention to the fact that staph aureus is not urease positive. So the double S that we have is for staph epidermidis and staph saprophyticus. So because of this enzyme, the proteus, that's one of those urease positive organisms, can always form a struvite stone because it will have splitted the urea into ammonia and CO2, and the ammonia is going to conjugate with magnesium and phosphate to form magnesium ammonium phosphate stone, which is a struvite stone that is very hard to pass. So if you are seeing somebody having struvite stones, you know that the person is having UTI from what? Proteus. I know that we have done that in RENA, right? That's not the first time we are hearing that, right?
Yes.
Okay, that's very good. So moving on to the to the catalyst organisms, to the catalyst positive organisms. So once we are done with this part, we go for a break, 10 minutes break, we come back. So the catalyst positive organisms, we already know this when we are talking about CGD in our immunology. You can see that everything is just linked together and it makes it very easy. What is the function of catalyst? Okay, I think I'll come back to show us some questions. Maybe I have one or two questions that I've forgotten. So the catalyst is an enzyme that degrades hydrogen peroxide into water and oxygen. We know that one already. And later, the hydrogen peroxide is going to combine with hypochlorite to form HO. It's going to combine with chlorine to form hypochlorite. And that reaction is catalyzed by the myeloperoxidase. So it is that hypochlorite that they use to kill, bacteria. So this hydrogen peroxide, is going to be broken down by catalyst into water and oxygen. But this hydrogen peroxide can also combine with chlorine to form hypochlorite, and that's catalyzed by myeloperoxidase. And they will use that hypochlorite to kill infection. So that is the process of the oxidative burst in the neutrophils. So neutrophils will, do that reaction from oxygen to superoxide to to hydrogen peroxide, and hydrogen peroxide to hypochlorite, and the neutrophils will now use that hypochlorite to kill that bacteria that they are phagocytosed. So that is the oxidative burst. But we have some bacteria that have the ability to produce their own catalyst. So that means that if they are catalyst positive, so that means that they can easily split the hydrogen peroxide into water and oxygen. So there's no way the neutrophils can combine hydrogen peroxide to hypochlorite again to kill those bacteria. So the bacteria will just be thriving and they'll be causing a lot of infection. So, and that's what you call the chronic granulomatous disease. That's just like a summary of the pathophysiology. It's actually more than what I've said, but I know we know it. I don't want to waste too much time on that. So what are these organisms? That is the acronym catalyst positive, notoriously big bubbling HASU. So I know that it's a lot of acronym, but with time we'll get used to all these things. Catalyst positive, notoriously big bubbling HASU. So the catalyst positive, the C for Candida, the P for Pseudomonas, the N for Nocardia, the B for Bordetella, the other B for Burkholderia. So Burkholderia is very important to talk about it in cystic fibrosis. Burkholderia cepacia, Bordetella pertussis. So Bordetella pertussis, Burkholderia cepacia, the Candida, the Pseudomonas, the Nocardia, then the ASU, Helicobacter pylori, the A for Aspergillus, the S for Staph, the other S for Serratia, the L for Listeria, and E for E. coli. So if you know this ASU, you already pick 6 organisms already. They just add the 2 B's, the big bubbling ASU, the Bordetella pertussis and the Porchidoria cepacia, and the Notoriously, which is Nocardia, and the CP. So that's that about the catalyst positive organisms. Then moving on to the pigment producing bacteria. There are some bacteria that produce some pigments. So if they describe a bacteria in the question and they say that they notice that there are some pigment that are being released, they can use that to guide you to the bacteria they are talking about. So, for example, Actinomyces estrelli will release some yellow sulfur granules. So it has this yellow coloration, and within this granule, there's filament of the bacteria. Then Staph aureus have golden yellow pigment being released. Pseudomonas aeruginosa have blue-green pigment being released containing pyocyanin and pyovadin. Then Serratia mercascens have a red pigmentation. So let us go for our break now. I will come back by 8 in 10 minutes time. Is that okay? Hello?
Yes.
Okay.
Yes.
So let me just see if we can solve 1 or 2 questions before we. Okay. So a 55-year-old woman with type 2 DM is admitted to the hospital because of 2-day history of fever, breathlessness, and cough, productive of large quantity of green sputum. She drinks 8 beer daily. Her temperature is 39 degrees Celsius. Pulse is elevated. Respiration 28. Blood pressure 160. Blood and sputum culture shows gram-negative, catalase-positive capsulated bacilli. Which of the following component of the causal organism is the most likely cause of this patient hypotension? Anybody?
Lipid A.
Lipid A. So this is sepsis, right? Because you can see the hypotension, you can see the fever, so that's septic shock and tachycardia. So, and they told us that the organism is a gram-negative, so that's why we have to pick lipid A. But if they change this to a gram-positive organism, what will be our answer?
Teichoic acid.
Teichoic acid. D.
Teichoic acid. So it's as simple as that. That's just a very simple way to look at it. Okay. A 43-year-old man is hospitalized for acute pancreatitis, and he develops a high fever and productive cough with thick sputum. Medical history is suggestive for alcohol use disorder. A sample of expectorated sputum is obtained and fixed to a microscope slide using heat. Crystal violet is applied to the slide, followed by iodine, then acetone, and lastly, safranin. A photograph of the result is shown. Which of the following properties of this bacterial cell wall is responsible for the color screen, for the color seen on this staining? So let us see what they are showing us here. Okay. So what do we have here?
Pink.
Gram negative.
Negative.
Gram-negative. So what option do we think we have to pick? Without even looking, which one do we think we have to?
Low peptidoglycan.
Low peptidoglycan wall.
Low glycoprotein. That's very good. So low
Okay.
glycoprotein.
And
They
then
can put high glycoprotein there. High
lipo.
peptidoglycan.
Mm.
So don't pick. Sorry, did you say low lipoprotein?
No, low.
Peptidoglycan.
Peptidoglycan content.
Low peptidoglycan.
Mm.
So if it was gram-positive now, we'll have picked high
High.
peptidoglycan.
Can they, Dr. Babawale, can they say high lipopolysaccharide or poly? Yeah.
No, so lipopolysaccharide is an amino
Gram
acid
negative.
entirely. Yeah. So gram-negative for what? For what? What's it for?
Endotoxin.
Endotoxin. And what does that cause? Endotoxic or septic
Shock.
shock. So that is
Okay.
not the one for the gram staining. The one for the gram staining is what? The peptidoglycan.
Okay.
Okay. So if it was tuberculosis, what would be the answer?
High
Because
folic
high
acid.
folic acid.
Acid. Mm.
That's the way it works. So I don't think I have any more. So a lot of questions there. You know, just understanding the principle. That's all matters. Don't worry yourself about not seeing thousands of questions. Once you have the principle, you can tear any question apart. You won't be scared. So moving on to the pigment producing bacteria. So a lot of them produce pigment. Actinomyces israelis is one, and we said it produces sulfur granules. So once you see yellow sulfur granules, that is Actinomyces israelis, until otherwise proven. Staph aureus, golden yellow, golden yellow. So once you see golden yellow in your exam, Staph aureus. Pseudomonas aeruginosa produce blue-green pigment, which is due to release of pyocyanin and pyoverdine. That is what impacts the blue-green pigmentation of Pseudomonas aeruginosa. Then we have the Serratians macacens. Serratias macacens, red pigment. Red pigment. Serratia macacens is one of those catalyst positive organisms. Don't forget. It can cause UTI, and it release red pigment, and it is a catalyst positive organism. Moving on to the biofilm producing bacteria. So the bacteria that have a tendency to form biofilm in vivo. The first and the most important that you cannot forget is Staph epidermidis. Staph epidermidis. Staph epidermidis. And it gets attached to the catheter and the prosthetic devices. So if we catheterize somebody and we apply prosthetics to somebody within the first 3 months, there's a high chance of colonization with Staph epidermidis because it has a tendency to form biofilm. So what property of the organism allows for that formation of the biofilm?
Slime.
Slime layer.
The slime layer. So viridans, streptococcus, like strep mutans or strep sanguines, they can form biofilm by attaching to the dental plaques, which can be responsible for forming infective endocarditis. So they are able to attach to dental plaques because they can form biofilm on those plaques. Pseudomonas aeruginosa too, you cannot forget that Pseudomonas aeruginosa is associated with contact lens keratitis. Step 1 and step 2 eye yield. Somebody using a contact lens and start developing, red eye, painful eye, tearing. That is contact lens associated keratitis from colonization with Pseudomonas aeruginosa. Step 1 and step 2, very high yield. People on ventilator are sharing pneumonia. Once you are on ventilator and you are developing pneumonia, they will give you coverage for Pseudomonas. That is the way it is. That person must receive coverage for Pseudomonas aeruginosa because it can colonize those ventilator pathway and form biofilm. So that's that about Pseudomonas. And lastly, cystic fibrosis. So people with cystic fibrosis, particularly the older people, right, can get infected with Pseudomonas and it can form biofilms on the airway. So we know the ones in younger people. So which one should we be worried about? Cystic fibrosis in young people?
Staph aureus.
Staph aureus. Good. Then the last is otitis media. So infections like non-typeable H influenza. So this is not H influenza type B. Please don't mix it. So we have the typeable and the non-typeable influenza, or otherwise known as the unencapsulated or the encapsulated. So the one that we can type are the ones that have capsule. So the one in Shin is a capsulated form. Why the one that cannot be typed, those are the unencapsulated type, and they are the one that can form biofilms in the hair, causing otitis media. You have to get that straight. Very important. So moving on to the spore-forming bacteria. What are the bacteria that form spore? So which category of bacteria do we say can form spore? Anybody remembers?
Gram positives.
Gram positive.
Positives.
The gram
Positive.
Positive.
Yes, so the gram-positive. So um, gram-positive organisms can form spore, just like we said, and I also listed some of those components of the spore, which includes the picolinic acid, the keratin coat. I talked about the DNA and the peptidoglycan cell wall. And they assume that spore form to reduce metabolic activity, and that spores also protect them, from heat injury and desiccation, as well as protect them from chemical injury. So the dipicolinic is responsible for the heat resistance. The keratin coat prevents against chemical damage, the heat, as well as the water, the desiccation, the dryness. How do you kill off organisms that exist in spore form? You can kill them off by autoclaving. So you have to autoclave. You can't just boil. You have to autoclave them by, steaming our surgical equipment at 121 degrees Celsius for 50 minutes. So once you steam at 121 degrees Celsius for 50 minutes, you are going to kill the spores. You can also use hydrogen peroxide and iodine-based agent because they are also sporicidal. So to kill spores from our surgical equipment, for utensils and all those things, you need to autoclave them by heating to 121 degrees Celsius for 50 minutes, or you apply hydrogen peroxide and iodine-based solutions. So what are these particular spore-forming bacteria? Some gram-positives like the B and the C's. The Bacillus produce spore. Clostridium produce spore. So Bacillus anthracis causing anthrax. Bacillus cereus causing food poisoning, right? Clostridium botulinum causing botulism. Clostridium difficile causing pseudomembranous colitis. I know we are familiar with that. Clostridium perfringens causing gas gangrene. We mentioned that in dermatology. And Clostridium tetani causing tetanus. So all the Clostridium and all the Bacillus, they produce spore, and you need to autoclave them to kill them off, or you apply hydrogen peroxide or iodine. Now, the bacterial virulence factors. This is very, very important because you are going to be asked in your exam. One of them is going to come out. And the virulence factors are like factors that is used by the bacteria to evade host response so that they don't get killed by the immune system. That is what the virulence factors exist for. The most important there is the capsular polysaccharide, which we have talked about. You see, we are mentioning it again. So it is a highly charged hydrophilic polysaccharide that helps to prevent again phagocytosis as well as complement-mediated lysis. So the complement cannot lyse them, and it also offers resistance against macrophagic phagocytosis. So that is a major one. It is the number one. Any organism that is not capsulated, has a very high predisposition for developing what's it called? Infection. Sorry, for any organism that is not encapsulated has a very high risk for getting eradicated by phagocytosis or complement-mediated lysis. So moving on to the next virulent factor that bacteria should have. And we remember the acronym for capsular polysaccharide organisms. Organisms that have polysaccharide capsule. What is the acronym? They are encapsulated. Anybody remembers?
Shane.
The Sheen specs.
Specs.
Specs. So the Sheen specs. That's the acronym for the encapsulated organisms. Protein A, they will ask you. And protein A is used by the number one organism. The protein A is used by the number one organism. The number one organism in microbiology is Staph aureus. So just remember that protein A is expressed by Staph aureus. They can ask you in your exam. Please don't joke with these 4 things. They can ask you in your exam. And how does it do it? So it just binds to the Fc region of IgG. You know that if Staph aureus release protein A, which binds to Fc region of IgG, that means that there is no space for the phagocyte to bind to, because phagocytes bind to the Fc region of IgG. The complements bind to that area to opsonize. So if there's no space for phagocyte and opsonin to bind to, there's no way opsonization, and phagocytosis can be completed. So that is how Staph aureus evades opsonization and phagocytosis, because it releases protein A, which occupies the Fc region of IgE. Do we understand that? Is it clear to us?
Yes.
So there's another virulent factor, which is IgA protease. IgA protease is also released by shin. It is only shin that also release IgA protease. And if you remember from our immunology, IgA is an immunoglobulin that colonizes which tract? Anybody knows?
Epithelial,
Respiratory,
and GI.
GI,
Yeah,
respiratory.
respiratory.
Exactly. Exactly.
Yes.
Yes. So anywhere that is lined by mucosa like the GI, the respiratory tract. So mucous membrane generally, that's where you find IgA. Now, some bacteria have the tendency to release IgA protease. IgA protease that will now come and be lysing the IgA that is attached to the mucosa. So if you have a mucosa like this, you have a mucosa like this, containing IgA. So here now we have IgA lining it. So now, strep pneumo wants to come and cause pneumonia. Pneumonia needs to go to the airway. It needs to go through the respiratory tract. But there's already IgA in the respiratory tract waiting for pneumonia, waiting for strep pneumo. So what strep pneumo will do is that it will release IgA protease that will now cleave off this guy so that it can gain entry into the respiratory tract and cause the pneumonia. Same with Haemophilus influenza type B. It can cause pneumonia because it can release IgA protease. Neisseria too can cause Neisseria meningitis. Even Neisseria gonorrhea. Gonorrhea infects the mucosa of the genitourinary tract. Neisseria meningitis also involves the mucosa of the airway, because you notice that Neisseria meningitis actually get what's the word now? Is it contracted now? It's being acquired through inhalation of droplets. So once somebody get exposed to somebody that is having that infection, a person sneezes and you hear the droplet, it enters into the airway and stay there. From there, it can now travel to the brain, to bloodstream, and cause maybe sepsis, which is meningococcemia, or go to the brain and cause meningitis. So it has to colonize in the airway first before it now decide on where it's going. So that's why releasing IgA protease is important for the Neisseria meningitis, so that it can eradicate the IgA that might fight against it when it enters into the respiratory tract. Do we understand that, or I'm just trying to confuse us? Do we understand?
Yes.
Okay. So the last part is the M protein. So M protein is well tested too. So this follows the principle of the molecular mimicry. So it also helps to provide against phagocytosis. So you will notice that what is common to all of them is phagocytosis. Everything is like phagocytosis, everything phagocytosis. So just remember, M protein 2 is phagocytosis, and it is expressed by gas. So I will not be stressing myself and be saying group A strep. In the microbiology lecture, we'll just be hearing a lot of gas. So when we are saying gas, we are saying group A strep. And a very important example of the group A strep is strep pyogenes. So this protein is expressed by this gas, and it also helps to lay off those phagocytes. So whenever the gas releases the M protein, the phagocyte find it very, very difficult to phagocytose it. And this M protein is also responsible for the autoimmune response that you see in acute rheumatoid fever. So because this M protein that they release is very, very similar in terms of its sequence immunology with the human cardiac myosin. So human cardiac myosin is a protein in the heart. So we have myosin, we have actin. So the composition of that myosin is very similar to M protein. So if somebody gets infected with gas enter the body, the bloodstream, the immune cells are going to recognize the M protein, and which is produced from the gas, and they will start producing antibody against that M protein. So gas comes into the body, it releases M protein so that it can prevent phagocytosis. Now, the M protein will be recognized by some of those immune cells, and they will be like, this thing is something we have seen before now, and they will produce antibody against it. Now, the antibody is now going to be attacking the SM protein, and at the same time, they are going to be attacking the cardiac myosin. Why? Because cardiac myosin and M protein are very similar in their sequence. They will think they are the same thing. So in the process, they are going to start causing inflammatory response in the heart, causing carditis. So that is why one of the components of acute rheumatic fever is what? Carditis. Hope we remember, or we have forgotten. Okay.
Remember.
So moving on to the bacterial genetics. So this is one of the a little bit complex part of bacteria and discussion of a whole. But I just want us to pay attention, and we just grab the concept once and for all. So don't forget these things, please. The polysaccharide, the protein A, the IgA proteins, and the M protein. Very, very important stuff. Can't joke with it. So the bacterial genetics. This is just talking about the way by which we can achieve horizontal gene transfer from one bacteria to another bacteria. That is the transfer genetic component, through one cell to another cell. And when we are talking about the bacterial appendages, I mentioned one component that allows this transfer. What is that component? Anybody remembers?
The pilus.
The pilus. Thank you. Thank you for following me. So the first one, we are going to be talking about the first principle to allow for this gene transfer is transformation. Transformation is simplest. So what happens in transformation? You have a competent bacteria, just like one bacteria. Let's say that we have a bacteria here. The bacteria is here, and the bacteria has a DNA. For whatever reason, the bacteria becomes lysed, and it gets killed off. The DNA is going to be released into the environment as a naked chromosomal DNA. Now, another bacteria might be playing around and will just come in contact with that naked DNA, and it will pick it up, and it will incorporate that naked DNA into its own genome, and is going to express it. That is transformation. So just the process of you just wandering up and down, you pick up naked DNA and you incorporate it and you express a gene. That is transformation. Very simple. Which organisms follow the principle of transformation? The Shin again. So we are talking about Shin. Shin specs, when we are talking about encapsulated organism, we got to transformation again, we are talking about Shin. When we got to IgA protease, we talked about Shin. So Shin is very important. Shin is very important. You have to know them. So sometimes we can add deoxyribonuclease to bacteria to degrade their DNA, preventing transformation. So if you don't want bacteria to be picking up DNA up and down, you can add deoxyribonuclease to that solution. It's going to degrade that DNA, and there's no way they can pick up anything. So that's just a way of controlling transformation process. Then it now becomes a little bit confusing when we start talking about conjugation. So the first thing that we have to understand with respect to conjugation is that in conjugation, you are using a sex pilus, more like a bridge. So the pilus is more like an appendage that forms a bridge, just like we have here, between two bacterial cells. Now, most of the time, for a bacteria to be able to form a pilus, they must have a plasmid, because the plasmid encodes the gene for formation of the pilus. Pilus is a glycoprotein, true or false?
True.
True. So that means that a gene must code for it, right?
Yes.
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 Gene codes for protein, true or false?
True.
Gene codes for carbohydrates, true or false?
False.
False. So the fact that it is containing the protein, so definitely a gene must be responsible for formation of that pilus. That is it. Nobody, once you understand principle of something, nobody can bobo you. you will know what you are talking about. That's why you have to understand and not cram. So, in a typical bacteria, most of them, they usually have two genomes. You have the bacterial chromosome, which is the one on top here. Then you have the plasmid. So this is the bacterial chromosome, this is the plasmid. You can have some genetic information contained in the bacterial chromosome. You can have some genetic information contained in the plasmid too. And this genetic information might offer some virulence protection. Maybe it can code for IgA protease, code for M protein, code for, which other one do we have there? Protein A and all those things. So different things depending on what the bacteria needs. So, but there are two different things. Now, the plasmid is the one smaller beneath, and that is the one that codes for the sex period. So that means that any cell that has a plasmid will definitely be able to form the sex pillars to transfer genetic material. So a cell that contains the plasmid, you call it the F positive cell. The F positive cell. The cell that does not have the plasmid, that only has its own bacterial DNA chromosome only, no plasmid, you call it the F negative. So in some situation, you can have transmission of your plasmid from the F positive to the F negative, so that you can make the F negative what? F positive. That is true conjugation. So what will happen is that this F positive cell that has the gene to code for the plasmid, to code for the pillars, will express the protein for the pillars. The pillars will be formed. The pillars will connect these cells together. Then the leading strand, the single strand, because plasmid is like double-stranded, just like DNA. DNA is double-stranded, so plasmid too is double-stranded. So a single strand of that plasmid is going to come out and go through that mating bridge from the pilus. The pilus forming the mating bridge, they will travel through that mating bridge and they will go to other cell. So that means that this one will contain one strand. This one too will contain one strand. Now, what will happen is that through the process of DNA replication, we know that DNA replication, we form the other strand, but with the use of the complementary strand, right? Is that not the way it works? So this one that has given one, we complete the entire, two by replication. This one too, which is the F negative that have received one, will complete its second one by DNA replication, so that both of them will be whole, having two strand, and it will be changed to a F positive cell. Do we understand what I've said? Is it clear to us?
Yeah.
So the take home here is that the only thing that they have exchanged, the interaction between F positive and F negative, the only thing they have exchanged is what? Plasmid.
Plasmid.
They have not exchanged any bacterial chromosomal DNA. Do you understand that? Very, very important stuff. Now, so it means that if this bacteria now wants to transfer its DNA chromosomal information, it needs to undergo something else. And that is where this interaction comes in. The high frequency recombination cell combining with the F negative cell. So what the high frequency recombination cell is just talking about is that, okay, now this F positive cell here has decided that I don't want to transmit plasmid. The information I want to give this cell is in my bacterial chromosome. What we go on do now? So the cell will now be like, okay, no wala. You sabi what you go do? Just incorporate your plasmid into your bacterial chromosome. Let us see what will happen. So it will now incorporate its plasmid into the bacterial chromosome, and you form this. So now you form this. You can see that this is the plasmid, this is the bacterial chromosome. You can see that the product is containing both colors. Can we see the diagram?
Please zoom in more.
Can we see it?
Yes.
So that means that this is the plasmid part and this is the bacterial chromosomal DNA part. So we call that a high frequency recombinant cell. Now, it will now move close to the F negative cell. That, okay, Shebi is you that want to receive my bacterial chromosome, no wala. So what will happen is that Because of the fact that it contains a plasmid, it can form sex pillows. True or false?
True.
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 So it will
True.
form the sex pillows, but what will happen is that instead of an entire single strand to come out, it is only the leading strand of the plasmid that would come out. So the leading strand, the leading part of the plasmid will come out, and it will drag along the component of that bacterial chromosome that you want to transmit. It will drag it along, and all of them, they would enter into that F negative cell and they will incorporate into it. Now, because of the fact that it is only the leading part of the plasmid that is living, it's not going to be able to duplicate that plasmid to form a whole plasmid. So that means that the only thing that is going to be dragged at the end of the day is just the bacterial chromosome. So that new cell is just going to be, it's going to be a recombinant cell, but it's going to be F negative because it will not contain a plasmid. Do we understand what I've said, or is confusing?
What's
The
the
last
last
part.
statement?
Last
The last
question.
part.
The last
Please, if you can take it again, we really
Okay,
appreciate that.
okay. So we can see it up to this level. This is the high frequency recombinant containing the plasmid and the bacterial chromosome. So they want to transmit the bacterial chromosome to an F negative cell. So what will happen is that because of the fact that this one already contains the plasmid, it's going to form the mating bridge. So, but you remember that when we are discussing the one on top, we said it is the entire single strand that leaves, right? So that it will just use it as a complementary strand to form a new strand to make it double. Do we get that part?
yes.
Yes.
But in this one, you see, the plasmid that has incorporated, it is not the entire single strand that will leave. It is only the leading part of the single strand that will leave. So that leading part will just drag along small parts of the bacterial chromosome that we need. It will drag it out, and all of the both of them, they will now enter into the F negative cell. Do we get that? Do you understand that? Hello? The leading
So the
part.
other part is like
Yeah.
But what happens to the
I don't know.
high cell? Will it still retain its DNA?
So because of the fact that it is only the leading part of the plasmid that is living, that leading part is not sufficient enough to form, to be replicated so that it can form a full plasmid. Do you understand that? So that cell that is receiving that plasmid is not going to be able to form a whole plasmid. Do we get it? So it will still be F negative. Do we get that? Do we first understand that?
Yes.
Now,
Yeah.
its name is now going to be changed to recombinant because you know that when this leading part of the plasmid was living, we said it dragged along some small part of this bacterial, what's it called? Chromosome. Small part. Do you understand? So that small part is going to be incorporated into it. So making it a recombinant, but it's going to be recombinant F negative because it's not containing a plasmid. So if you look at the color contribution now, you see that it contains its own DNA, which is this green, is still there. Green is still there. It contains a portion of this donor chromosomal DNA, which is this brown. We can see the brown here. And it also contains the leading part of the plasmid from this guy, which is the pink. We can see the pink and maybe some green, but doesn't contain the entire plasmid because the entire plasmid should be a mixture of pink, green, and blue, but only contains pink and green. Can we see the pink and the green? The blue is not there. So if the blue had followed it, it would have been a complete single strand, and they will be able to replicate that one to form a whole plasmid. Does that analogy make sense to us?
Yes, it does.
Yeah.
So just have it at the back of your mind that it is only the leading part of the plasmid that enters. It is not complete. It drags alongside some portion of that donor's chromosomal DNA. Then that chromosomal DNA and the plasmid, all of them, they will now be incorporated into the chromosomal DNA of the F negative cell, which is the recipient cell, and they are going to form a recombinant. But it's not going to become F positive because it does not form a complete new plasmid. It's just taking leading portion of that plasmid. Leading portion of that plasmid will not make it F positive. It has to be duplicated. So that is that about So what is the idea behind this? The idea behind this high frequency recombination and F negative interaction is that you'll be able to transmit some part of the donor's chromosomal DNA using the plasmid. The idea behind F positive, F negative interaction is that you'll be able to transmit the plasmid to another cell, making it F positive. Do we get the difference? But you are not transmitting chromosomal DNA. Do we get the difference?
Yes.
So one will transmit plasmid, no chromosomal DNA. The other one will transmit chromosomal DNA with some plasmid, but the plasmid is not going to be O plasmid. So once it is not an O plasmid, it is not going to be changed to F positive. It's going to remain as F negative, but to contain a copy of the plasmid. So the reason why I'm trying to explain this is that so that no matter the way they twist it in the exam, we'll be able to understand what they are talking about. Now, this one too is a little bit tricky. This is transduction. So we are done with conjugation. Conjugation is the one that uses pilus. Whenever they state it in the question that there's a pilus involved, just go and pick conjugation. Straight. You don't need to waste your time. So for transduction, it can be categorized into generalized and specialized. Generalized and specialized. Now, what are they talking about? Generalized transduction is a packaging error. So what happens is that there are some cells in the environment that we call the phage, the bacteriophage. I want to tell us that bacteriophage are actually viruses that infect bacteria. They are viruses that infect bacteria. Those are bacteriophage. The basic structure of a bacteriophage is just legs. Look at all these things that look like legs. Legs and the capsid. And what is enclosed within the capsid? The DNA. Can we see this red stuff? Can we appreciate what I've highlighted? The legs,
Yeah.
the capsid, and the DNA. So that's what makes up the phage. Now, what will happen is that a phage, the phage, please, let's mute our mics. Let's mute our mics, please. So the phage will come and infect that bacteria that it wants to transmit the DNA from that bacteria to another bacteria. So the phage will come and they will infect the bacteria. You see, the idea of the phage is that they just want to use that bacteria to proliferate their own DNA. That's their own stuff. But in the process, they'll be making mistake and they'll be transmitting bacterial DNA to another bacteria. Let's have a look. So the lytic phage comes. Because it is a lytic phage, it will enter and lyse the DNA of that bacteria so that it can release its own DNA into the bacterial cell and utilize the replicative machinery of that bacterial cell to replicate its own DNA. That's what it wants to do. It just wants to come, destroy that bacterial DNA so that it will release its own DNA so that the cell can replicate its own DNA. Then it will now repackage itself and become new and travel elsewhere. So after they have lysed the DNA, their own DNA will be replicated. Then the bacterial DNA, the phage will now start packaging itself into capsid. Let me make a point here. We know that if this phage comes in, release its DNA, and the bacterial cell replicates the phage DNA, the phage DNA is going to undergo DNA replication, DNA transcription, mRNA translation to form what?
Protein.
To form protein. the capsid is an example of a protein. So they will form the capsid. And what is the next thing? They will start incorporating some of those replicated DNA into the capsid so that they can form new what? Bacteriophage. Does that make sense to us?
Yes. Can you say it again?
So when the phage infect the bacteria, they destroy the bacterial DNA, they release their own DNA, and their DNA is going to be replicated. One of the end goal of DNA replication, in addition to replicating the DNA, is that you want to form protein. Because from DNA replication, it proceeds to DNA transcription, then from there to RNA translation. And I asked, what is a product of RNA translation? Protein. The capsid are protein. So they form new capsid from that process. And now some of those replicated DNA will now be packaged into those capsid as new bacteriophage. Do we understand now? Do we get it now?
Mhm.
Now, in the process of packaging, they will now mistakenly be packaging some lysed bacterial DNA into the capsid. Now, if you look at this packaging, you will see that you are seeing some product that contains bacteriophage DNA, like this one. This is bacteriophage DNA because it's red. Can we appreciate that?
Mhm.
And we can see some package that contains bacterial DNA, which is the one that contains green. So that means that some bacteriophage will actually be formed, that they contain bacterial DNA instead of bacteriophage DNA. So if those bacteriophage now develop, for example, this now, bacteriophage containing DNA of the bacteria, and they infect another new bacteria, they can easily transmit that bacterial DNA into that new bacteria, and from that, you have transferred this gene to this new cell. Do you understand, or I should come again?
I understand.
Again.
So some people understand, some people don't understand. But do we understand up to this packaging problem? Do we understand up to this packaging problem?
Yeah.
Yeah.
Now, what I'm now saying is that this is the original phage. It should contain phage DNA, which is red. So it means that all this one, they are normal phage products, which is good. But there are some packaging error because we have some phage that actually contains bacterial DNA, not phage DNA, which is this green DNA. Can we see? Can we see? This is bacterial DNA because this is the bacteria. It's just due to the packaging error that they are mistakenly packaged the bacterial DNA inside the phage capsid to form a bacteriophage. Do you understand? So if one of these bacteriophage now go outside and infect a new bacterial cell, it can easily release that bacterial DNA to that different bacterial cell. And this, you are going to have this recombination, this product. Can we see? So that means that this bacterial cell has been given an old bacterial DNA from the initial infection here. Do we get that? So that means that that is a way to transmit DNA from one bacteria to another bacteria. Do we understand? So
Yeah.
that is due to packaging error. That is generalized transduction. Now, there's another one that we call specialized. Now, specialized is an excision event. So it's more like an excision error. It is not packaging error. The bacteriophage is still going to play a role here. But this bacteriophage does not lyse the bacteria. So if you are seeing bacteriophage involved and it does not lyse bacteria, you already know that this is likely to be specialized transduction, not generalized transduction. So they will tell you that the phage comes in, it is not going to be termed a lytic phage, but a lysogenic phage. So the lysogenic phage comes in. What it will just do is that it will just leave the bacterial DNA there, but it will incorporate its own DNA into that bacterial DNA, and you have this product. So that's the first step. Then the next step is that they are going to replicate this genome like this. After it has been replicated, so what that lysogenic phage will now do is that it will now try to cut, like it's going to try to cut out its own part alone so that they can package that one into capsid and form new bacteriophage. Do we understand what I've said?
Yes.
So it comes in, so we have to be looking at this diagram to understand. It comes in, it incorporates its DNA into the bacterial DNA. So this purple is going to mix with green, and you are going to have this. You are going to have this product. You are going to have this product. Can you see this? Now they will replicate this product. After they have replicated, the next thing is packaging, right? They have to start packaging. But before they start the packaging, they will try to cut out their own genome because that's what they need. They will try to cut out the is it what color is it purple? They try to cut out their purple from here. Do we understand? So that they can incorporate this into the capsid. But in the process of excising, of cutting, instead of cutting from here, they will cut from here by mistake. Cut from here. So they will be flanked with some components of the bacterial DNA. Do you understand? So that you notice that what is packaged is containing both the green and the purple for the bacteriophage. Can we see? Can we see? Can we
Yeah.
see? So
Yes.
that one will now mature and they will form the bacteriophage. And in the process, the bacteriophage will now go and transmit the entire genome into another cell. So in the cell, you are now going to be having both bacteriophage genome, which is this color, and the old bacterial cell infected, which is this green, and the new bacterial cell infected, which is this, what's it called? Is it blue or what's the color? Do you understand what I'm trying to say?
Yeah.
So that means that the error is actually from excision error. And
Okay.
and the new cell is going to be containing DNA from the lysogenic phage as well as the old bacteria infected by the lysogenic phage. But for lytic phase, the new cell is only going to contain DNA from the old bacteria. It is not going to contain DNA from the lytic phage. But in the lysogenic, it's going to release the three, its own DNA, the DNA of the bacteria from the old cell, and mix with the new cell because it is a excision error, excising genome containing the old bacterial genome and its own genome. So specialized is much more abundant in terms of the gene involved for the new cell. It will contain the gene of the lysogenic phage, the gene of the old bacteria, and the gene of the new bacteria. But for lytic, it's only containing the gene of the new bacteria and the gene of the old bacteria. That is all.
So I have a question. So the generalized one, the lytic, is it because it breaks down the bacteria gene first and then incorporate themselves? That's why we call it lytic or something.
Exactly. So we call it
Okay.
lytic because it comes in and breaks those bacteria, breaks them.
Okay.
Yeah. So if you look at the packaging, you see that either you can't mix the genome together. Either you are packaging bacteriophage genome into the capsid, or you are packaging the old bacterial genome into the capsid. Can you see? The color is usually distinct. Can you appreciate that?
Yes.
But here,
Yeah.
because it's excision error, so that means that every packaging will always contain some component of this old bacteria. So that is the reason. So let us now, before I go, we have to also know that the specialized transduction is a means by which you can transmit the gene that encodes all these toxin. So the toxin that encodes for A, B, C, D, S. A for gas, the group A strep erythrogenic toxin, B for botulinum, C for cholera, D for diphtheria. So diphtheria infection, cholera infection, botulinum toxin infection, and gas erythrogenic toxin infection, and S, which is the sugar toxin, they are transmitted through specialized transduction. You forget that at your own. Don't forget it. Very, very important stuff.
Okay,
So,
which one is transmitted through the lytic?
no, and any other thing can be transmitted. But the one that is specific to
Specific is just this.
the specialized is just this.
It's the ABCD. Okay.
Yes, toxin. So we have to talk about the transposition. So transposition is the last part. So transformation, conjugation, transduction, and transposition. So transposition is very simple. What is just in transposition is that you can have some genes that you call transposons. Transposons are otherwise known as jumping genes. Most of the time, you have them in the plasmid. So jumping genes have ability to either duplicate itself or cut itself from the plasmid and jump to another plasmid or jump to another bacterial DNA. That is all. So in the process, you have exchanged gene from one part to another part. So for example, you can have Enterococcus containing a plasmid, and the plasmid has a transposon, and maybe this transposon encodes for resistance against vancomycin. Now, once Enterococcus interacts with Staph aureus, what is going to happen is that this transposon is going to cut itself, or it can copy itself, and it will jump to the chromosomal DNA of Staph aureus, and it will paste itself, on the site of Staph aureus. In that process, Staph aureus becomes vancomycin resistant. That's it. It's just jumping. That is it. Do we understand that? Hello?
Go again. I'm trying to differentiate it from the transformation.
No, transformation is not copying. Transformation is the cell picking naked DNA in the environment. Naked DNA is in the environment, and they come and they pick it. That is it.
Okay.
Transposition involves two living bacteria.
Okay.
One contains a transposon, which is the jumping gene. And this jumping gene usually encodes something that is beneficial. It could be vancomycin resistance. It could be anything. Think of anything. Now, when the bacteria that contains the jumping gene interacts with another bacteria, you can have cutting of this jumping gene or copying of this jumping gene to that bacteria DNA, to the other bacterial DNA.
The other one.
And it will paste itself. Look at this now. This is bacteria. It's copy and paste here. And the bacteria will start expressing the gene, and they will become, better in any way.
Okay. So the new bacteria, does it have its own gene initially? So it now is having two, its own gene and the first bacteria.
Yes. So if you look at this, we will see that this is talking about the bacterial DNA. Doc, can you see that? Now they said there's a target site here.
Yes.
So this is the place that the transposon is going to deposit on. So once it comes, it deposits here, and that bacteria is going to express whatever that gene codes for. So that's transposition. Let's look at some questions here. The first one is,
again, but for transformation is just one bacteria doing picking up. It doesn't involve two.
No.
I see. I get
picking up a naked DNA in the environment.
Okay, thank you.
And it is only Shin that does transformation. Shin does transformation. Shin does transformation.
Okay, yes.
An investigator studying the mechanisms. This question is very tricky, so let's pay attention. Don't get distracted. An investigator studying mechanisms of acquired antibiotic resistance in bacteria conduct a study using isolated strain of E. coli and Staph aureus. E. coli and Staph aureus. The E. coli strain harbors plasmid that conveys resistance to kanamycin. The Staph aureus strain is susceptible to kanamycin. Okay. Both bacterial strains are mixed in a liquid growth medium containing deoxyribonuclease. After incubation for 2 days and subsequent transfer to a solid medium, the Staph aureus colony show no lysis in response to application of kanamycin. So that means that they are now kanamycin resistant. Analysis of the chromosomal DNA from the kanamycin resistant Staph aureus strain do not reveal the kanamycin resistant gene? How come? Analysis of the chromosomal DNA from the kanamycin resistant Staph aureus do not reveal the kanamycin resistant gene. Which of the following mechanism is most likely responsible for this finding?
The transposon transposition.
No, this is not true. But
Conjugation.
they didn't
This
say anything.
conjugation by plasmid.
Conjugation.
Yes. Why do we say it's conjugation? Anybody?
Oh, it's
Because of the plasmids.
Exactly.
Transfer
So
of
what form of
plasmid.
conjugation is this?
the second one, the HFR, HFR.
No, it is not the
Is the
second one.
normal one.
Ah.
Because they said,
One because he's only taking is only the only thing that has the only thing that has the resistance is the plasmid. So when they tested the actual DNA, they didn't see anything because it's the plasmid that has the resistance.
exactly.
I think.
Yes. They said
So,
the E. coli abhors the plasmid, the plasmid that contains the mutation. Fine. E. coli contains a plasmid that contains the mutation. Good. The Staph aureus is susceptible to be kanamycin. So the E. coli contains a plasmid that makes it resistant to kanamycin. The Staph aureus is susceptible to kanamycin. When they incubated them together, they noticed that after some time, Staph aureus shows no lysis to kanamycin. So that means that Staph aureus is no longer destroyed by kanamycin. It is now kanamycin resistant. Okay, so many things could have been responsible for that. They now said that they did analysis of the chromosomal DNA from kanamycin resistant Staph aureus, but they did not see the kanamycin resistant gene. So if they are not seeing the kanamycin resistant gene in the chromosomal DNA, where will it now be? It is going to be in the plasmid. So it means that this E. coli only transmitted its plasmid to the what? To the Staph aureus. And which interaction did we say is going to involve only transfer? Which interaction? The F positive,
Yeah.
F negative.
F negative.
If they are
F
told us that,
positive.
if they are told us that,
Plus.
if they have told us that when they did the analysis, they saw the mutation in the chromosomal DNA, what would it have picked?
F positive cell.
The second one, the high frequency.
High frequency,
The high
F
frequency,
negative
yeah, conjugation.
interaction. That is it. But if you check for plasmid in the high frequency F negative interaction, are you going to find the plasmid in the Staph aureus?
No,
No.
absolutely. No, F negative.
No.
Yeah.
So we have to still, take our time to digest and understand that interaction, because the USMLE, they will twist it. That's it. So you have to understand. Understanding is the most important thing. An investigator is studying bacterial adaptation to the environment in an infectious isolate and non-infectious isolate of Haemophilus type B. Animals exposed to the non-infectious isolate do not develop symptoms of infection. Animals exposed to the non-infectious isolate, do not develop symptoms of infection. The investigator cultivates the non-infectious isolate in a culture with lice bacteria from the infectious isolate. Some of the animals exposed to this bacteria develop symptoms of infection. Which of the following process is most likely responsible for the described finding?
Transformation.
Transformation. That is very simple. Transformation.
Transformation.
Because at first, if they get exposed to that one, they did not get it. Now after missing them, if they get exposed to it, they get the disease. Okay, I understand now.
Exactly, because when they now culture with the lysed form, they were able to now get that tendency to cause infection. Do we understand? So let me take it
And
again
also,
first.
also because of the fact that it's Shane, right? It's among the Shane as well, too. Just as you mentioned
Yeah,
before,
so
Shane is for
exactly.
transformation as
The
well.
Shane 2 is there, so
No,
which is a
no,
full
no.
of
I think the Shin will even confuse because Haemophilus influenza is involving ressortment, and that's my confusion in this question. Even though we haven't done ressortment with you, but in an exam, it's not what we did with you. They're asking us the whole story. So how do we differentiate it from ressortment?
So this is not ressortment. We have not gotten to ressortment. When I get to ressortment, I'm going to explain it. So because this has been stated already, because if it's ressortment, you can get the infection without even lysis. The fact that they are cultured together, they can get the infection. They can get that attribute. But they said that when they mix them together without lysis, they did not get it. But when they are mixed after lysis, they got it. So that's already talking about something else.
Okay.
So when we get to ressortment, I'm going to explain the principle of ressortment, and there's no way we can be confused. So what I'm just trying to explain initially was that for some of us that don't understand it, they said an investigator is trying to study bacterial adaptation to an environment in an infectious isolate and non-infectious isolate of type B. So we have the form of type B influenza that can cause infection, and we have another form that cannot cause infection. So they said animals exposed to the non-infectious isolate do not develop symptoms of infection. So we expose animals to the non-infectious form of the Haemophilus. There's nothing. They can't cause infection. So the investigator now decided to cultivate the non-infectious isolate in a culture with lysed bacteria from the infectious isolate. So the change that the person is doing here is the lysis. So the investigator lysed the bacteria that have the tendency to cause infection, and the person incubated that with the isolate that cannot cause infection. And immediately after that, some of the animals exposed to this bacteria now start developing infection. So that means that the non-infectious isolate starts becoming infectious because they have received DNA from the lysed bacteria that has a tendency to cause infection. And that is what we expect for transformation. So that is that. Ressortment is very common in viruses, usually. So not here. So sorry. Okay, yeah. So when we get to viruses, we start talking about ressortment. So this is a bacteria, you will not expect ressortment to happen.
Okay.
So the last one, an investigator is studying bacterial toxin in a non-pathogenic bacterial monoculture that has been inoculated with specific bacteriophages. These phages were previously cultured in a toxin-producing bacterial culture. After inoculation, a new toxin is isolated from the culture. Genetic sequencing shows that the bacteria has incorporated viral genetic information, including the gene for this toxin, into their genome. The described process is most likely responsible for acquired pathogenicity in which of the following bacteria? Anybody?
Staph aureus.
Diphtheria.
Diphtheria.
Somebody said
Diphtheria.
Staph aureus. Somebody said Staph aureus. Why are we picking Staph aureus? Why? Why Staph aureus?
Opporus is not there.
No, diphtheria. Diphtheria.
There's diphtheria,
What
there's
form of
chickenpox.
interaction is this?
It's
Specialized transduction.
specialized transduction.
Specialized transduction. They already told us. They even made it they were very generous. They said specific bacteriophage
Mm-hmm.
transduction. And the only organism here that can undergo that its toxin is transmitted through transduction is what? Corynebacterium diphtheria. We said
Diphtheria.
A, B, C, D, S.
Yes.
Application. That's it. So moving on to difference between exotoxin and endotoxin. So exotoxin, they are majorly produced from gram positive and gram negative. But endotoxin can only be produced from gram-negative, right? We said this.
Yes.
Yes.
Exotoxin are secreted from the cell. Yes. You cannot secrete endotoxin from the cell. You have to break that cell. You have to break it down. Because endotoxin is part of the cell membrane. Do we remember? So that means that you have to destroy that cell to release endotoxin. So endotoxin is never secreted. Don't fall victim. What is the composition of exotoxin? They are polypeptides, right? What is the composition of endotoxin? Lipid A. We have talked about this. Released when the bacteria is lysed. Where are they located? The gene that encodes for the exotoxin. We talked about the plasmid and what? The bacteriophage. When we are talking about specialized transduction, right? All these botulinum toxin, diphtheria toxin, all these things are exotoxin. Exotoxin. So bacteriophage can, can contain them as well as the plasmid, while the endotoxin is strictly from the bacterial chromosome. Toxicity. The toxicity of exotoxin is high because you require a small dose to cause problem. While that of endotoxin is low because you need hundreds, to cause problem. So exo is more toxic than endo. What can exotoxin cause? Exotoxin can cause so many things depending on the specific exotoxin. What the exotoxin of diphtheria is going to cause is different from what exotoxin of cholera is going to cause. Hope we agree with me. True or false? So it depends on the specific organism. What the diphtheria toxin is going to cause is diphtheria. Cholera toxin is going to cause cholera. What is it called? Clostridium toxin is going to cause Clostridium infection, tetanus. So they differ based on the organism. But all endotoxin are going to cause one common thing, which is what? What is that?
Sepsis.
Sepsis.
Toxic
They are going to
shock.
cause they are going to cause endotoxic shock. So regardless of the organism, it is common. Toxic shock, endotoxic shock. How do they work? For the exotoxin, it depends on the specific toxin. We are going to be looking at it next time. Then for the endotoxin, all of them release interleukin 1, interleukin 6, and TNF that is going to lead to what? Septic shock. What about the antigenicity? Exotoxin, we can develop antibodies against them. Don't forget they are proteins, so you can develop antitoxin. So that's why we have antitetanus antitoxin. That's why we have diphtheria antitoxin. But you cannot develop antitoxin. You cannot develop antibody against endotoxin. Most of them are like lipid and polysaccharides, so they are polyantigenic. Vaccine, yes, we can develop vaccine against those guys that secrete the endotoxin. Yeah, toxoid vaccines. You just take a component of that toxin and you denature it. And once you denature it, you introduce it into the human cell. If you introduce it into the human blood, do we think antibodies are going to be mounted against it? True or false? True or false?
True.
True. The antibodies can be obtained as as the antitoxin, So the denatured toxin that we are giving to provoke the immune response is called a toxoid. So we must know the difference between toxoid and antitoxin. So toxoid are used as vaccine. You just take a denatured exotoxin. For example, denatured exotoxin of diphtheria. We take it. So we have made it attenuated in a way, and we put it, as a vaccine. We inject it. The body is going to recognize it, and it's going to provoke inflammation, like immune response, and there's going to be formation of antibodies. The antibodies are what we keep as an antitoxin. So toxoid is active immunity. True or false?
It's true. Active.
Toxoid is active immunity. True or false? There's no catch. This is immunology. Huh? True or false? Toxoid. Giving toxoid is active immunity. True or false?
True.
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 Giving antitoxin is active immunity. True or false?
False.
False. No catch. I'm just trying to tell test our immunology knowledge.
Mm.
So for the endotoxin, there's no toxoid, no vaccine. What about the heat stability? We can destroy the exotoxin rapidly by heating at 60 degrees. The only one that you cannot destroy are the staphylococcal enterotoxin, the E. coli heat stable toxin. We have E. coli toxin that is not heat stable. It is only the heat stable one that we cannot destroy with eating. Then we have the Bacillus cereus emetic toxin, which is the when we start talking about reheated rice syndrome, what is responsible for reheated rice causing food poisoning is because the Bacillus cereus contains an emetic toxin that is heat stable. So staphylococcal enterotoxin, E. coli heat stable toxin, and Bacillus cereus emetic toxin are all heat stable. You cannot destroy them. For endotoxin, it is stable at 100 degrees for 1 hour. You don't need all this information. Nobody is going to ask. So what are the typical diseases? Tetanus, botulinum infection, diphtheria, cholera, all those exotoxin, why the endotoxin is just sepsis from gram-negative rods, meningococcemia, just like I mentioned. It's a form of sepsis, from Neisseria meningitis. So, and what endotoxin do we think is going to be released by Neisseria meningitis? What endotoxin?
LOS.
LOS.
Yes.
Good. I thought you had forgotten it, but still with us. That's good. So we'll continue from here tomorrow. At least we have made some progress. Do we have any question?
Yeah, Doctor.
Yes, please. I have a question.
endotoxin
Okay.
is poorly antigenic. Does it mean there's no vaccine for all the endotoxin?
No. If there's a vaccine for endotoxin, that means we'll be using vaccine to prevent shock. Can we prevent shock with vaccine? No. So there's no vaccine. Because it is lipid. See, lipid A, polysaccharide. There is no way we can provoke solid immunogenic response against like a lipid, antibody against a lipid. It has to be a protein. Do you understand? So that's the reason why it's poorly antigenic. So, any question or any other question? And that doctor wants to ask you.
Yes, please. Yes, I have a question.